Have you ever looked into the toilet and noticed your urine was unusually foamy, with bubbles that didn't disappear quickly? Naturally, questions pop in your mind. Is it dangerous? Could it be a sign of kidney disease? The answer is it depends. Sometimes foamy urine is completely normal. Other times, it can be one of the earliest signs that your kidneys are leaking protein. Hi healthy buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. And today we will talk about foamy urine, the common causes of it, when you should be concerned, what tests your doctor may recommend, and the treatments available. Before we begin, let's learn some basics about our urinary system. Understanding these concepts will make the rest of today's discussion much easier. The first is proteinuria. It is from the word protein and urine. It simply means that an excessive amount of protein is present in the urine. This is human kidney. Normally, we have two kidneys that prevent most proteins from entering the urine. If the kidney's filtering system becomes damaged, protein leaks through, resulting in proteinuria. This is glomerulus, the extremely sophisticated biological filter. Each kidney contains about 1 million of these microscopic filtering units. Its job is to remove waste products and excess water while retaining important substances like the red blood cells and proteins. When this filtration barrier damaged, proteins escape into the urine. The urine will bubble when air trapped in it. But without the protein, the bubbles won't last long, just like when we are whisking water. In proteinuria, the bubbles persist in the urine, forming foam. Because protein molecules are amphiphilic, they are both hydrophobic and hydrophilic. Hydro means water, philic means loving, and phobic means averse. The hydrophilic ends of the protein molecules are attracted to the water in the urine, while the hydrophobic ends are attached to the air in the pockets. That is how persistent foam in proteinuria happens, just like when we whisk to introduce air into protein-rich liquids like egg whites or milk. But here is the important point. Not all foamy urine contains protein, and not all proteinuria causes dramatic foam. That is why persistent foamy urine should never be diagnosed based on appearance of the urine alone. Laboratory testing is essential. Let's begin our talk about foamy urine with the reassuring possibilities. Sometimes foamy urine is entirely normal. One common reason is simply urinating with a strong stream. If your bladder has been very full, the urine exits under higher pressure. When it strikes the toilet water, turbulence creates bubbles, just like pouring water rapidly into a sink. These bubbles usually disappear within seconds. Another normal situation occurs after holding urine for several hours, such as first thing in the morning. The urine in this condition naturally more concentrated, making temporary bubbles more likely. Cleaning agents remaining inside the toilet bowl can also create foam, making it appear that the urine itself is abnormal. In these situations, the foam is temporary, inconsistent, and not caused by disease. Possible causes number 4 is dehydration. It is one of the most common and overlooked cause of foamy urine. When your body loses more water than it takes in, the kidneys conserve water by producing concentrated urine. This concentrated urine contains higher concentrations of natural substances as urea, electrolytes, and other dissolved particles. The higher concentration may make bubbles more noticeable. Signs that dehydration may be contributing include dark yellow urine, increased thirst, dry mouth, dizziness, and reduced urine volume. The treatment of dehydration is straightforward. Drink enough fluids throughout the day, especially during exercise, hot weather, illness, vomiting, or diarrhea. However, if you are living with heart failure or chronic kidney disease, always follow your physician's individualized fluid recommendations rather than simply increasing water intake. We come to the most clinically significant cause of foamy urine. Persistent foamy urine can indicate proteinuria. Healthy kidneys act as selective filters. When the glomeruli become damaged, proteins, especially albumin, leak into the urine. The protein stabilizes bubbles in the urine, producing persistent foam. Proteinuria per se is not a disease. Instead, it is a sign that another medical condition may be affecting the kidneys. People with significant proteinuria may also have puffy eyes, swelling of the ankles, weight gain from fluid retention, fatigue, and high blood pressure. However, and this is very important, many patients experience no symptoms at all, especially at the early stage. Persistent foamy urine may be the first clue. Common causes include diabetes mellitus, high blood pressure, and glomerulonephritis, which refer to the inflammation of the glomeruli. Glomeruli is the plural form of glomerulus. And autoimmune disease such as lupus, and certain inherited kidney disorders, obesity-related kidney diseases, and some medications, multiple myeloma, and other less common causes. Diabetes is among the leading causes of chronic kidney disease worldwide. Persistently elevated blood glucose damages the delicate blood vessels inside the glomeruli. Initially, tiny amounts of albumin begin leaking into the urine. But without treatment, progressively larger amounts of protein leaks into the urine. The encouraging news is that early diabetic kidney disease can often be slowed substantially by controlling the underlying diabetes. I have covered about diabetes in greater detail in another video, including its treatment and prevention. You can watch that video to know more about it. Hypertension is another common cause of chronic kidney disease. High blood pressure gradually damages blood vessels throughout the body, including those inside the kidneys. Over the years, this reduces the kidney filtering efficiency and increasing the protein leakage. Hypertension itself has no symptoms, but organ damages caused by hypertension have. It usually happens when the hypertension is uncontrolled for a long period of time. Please watch this video if you want to know more about hypertension. Glomerulonephritis is another condition with foamy urine. There are many different things that can cause inflammation of the glomeruli, and treatment depends entirely on the specific diagnosis. Some cases require immunosuppressive medications. Others improve after treating an infection or addressing the underlying diseases. This is why proper evaluation by a physician is essential rather than assuming all proteinuria has the same cause. Although less common, foamy urine may also occur in retrograde ejaculation. This is when semen pushes back into your bladder upon ejaculation instead of going out through your penis. Then amyloidosis, when the protein in your body mutate. It can affect your kidneys too. Then pregnancy complicated by preeclampsia, multiple myeloma, and intense physical exercise causing temporary exercise-induced proteinuria. Fortunately, exercise-induced proteinuria usually resolves within 24 to 48 hours after recovery. If foamy urine persists, your doctor may recommend a urine dipstick, a urine albumin to creatinine ratio test, a urine protein to creatinine ratio, and urinalysis with microscopy. Also, blood tests, including serum creatinine and estimated glomerular filtration rate, or eGFR for short, and blood glucose testing, blood pressure measurement, occasionally kidney ultrasound, and in selected cases, doctor may call for a kidney biopsy. These investigations help to determine whether protein is present, how much is leaking, and what the underlying cause may be. It is extremely important to know the main cause because different cause needs different treatment. There is no single treatment for foamy urine because foamy urine per se is a symptom, not a disease. Treatment of foamy urine, therefore, depends on the underlying diagnosis. For example, if it is because of dehydration, then you need to increase fluid intake appropriately. For diabetes, you need to optimize glucose control and use kidney protective medication when indicated. For hypotension, you need to maintain blood pressure within target range and take medication consistently as prescribed by your own doctor. For chronic kidney disease, then you need to apply healthy lifestyle, maintain a healthy body weight, then control the cholesterol, and follow up regularly with your healthcare provider. Early intervention can significantly slow progression towards kidney failure. Patients should avoid unnecessary use of drugs and check with their attending physician when they need one. Now, here are the red flags that you need to remember related to the foamy urine. You need to get medical evaluation if foamy urine persists for several days or occurs repeatedly. If it is accompanied by swelling, or if you saw blood in the urine or your urine is pinkish, and it occurs with high blood pressure and diabetes, or if it is associated with reduced urine output, or if you have a family history of kidney disease. Persistent proteinuria should never be ignored. Let's summarize today's discussion. Foamy urine is common and often harmless. Temporary foam may result from a strong urine stream, concentrated urine, or dehydration. However, persistent foamy urine may indicate proteinuria, which can be an early sign of kidney disease. The common underlying causes include diabetes, hypertension, and diseases affecting the kidney's filtering units. Fortunately, many kidney diseases respond much better to early treatments. So, if you notice persistent foamy urine, don't panic, but don't ignore it either. A simple urine test may provide valuable information about your kidney health. That is my sharing today about foamy urine. I hope you found this information helpful and can be a blessing. Please like this video and subscribe to my channel so you can continue to receive this kind of evidence-based health information from me. If you have any health-related questions or topics you want me to cover in the future videos, kindly type in a comment below. But please do not consult your personal health issue here, as it must be done personally with your doctor. This is my disclaimer. Thank you for watching and see you in the next videos. Stay healthy and happy.